Are you feeling tired, foggy, or moody more often than usual? You might be missing something crucial in your diet, and honestly, it's not just about iron or sleep. Today we're diving deep into vitamin B12 deficiency, how it can mess with your body, brain, and even your personality. Let's get into the science of why a tiny vitamin can lead to massive problems, including irreversible nerve damage and psychiatric symptoms. B12 deficiency can develop slowly and symptoms may sneak up on you. Here's what to look out for: fatigue or weakness, pale or jaundiced skin, tingling or numbness in hands and feet, that's called paresthesia, memory problems or cognitive decline, and mood changes, including depression and anxiety. In the United States, it's estimated that anywhere from 1.5% to 15% of the population may be B12 deficient, and that number climbs with age. For adults over 60, at least 6% are clinically deficient, and as many as 23 to 35% may have subclinical B12 deficiency, meaning their levels are low enough to cause problems, but not low enough to show up on standard lab tests. Pernicious anemia is a type of B12 deficiency that occurs when the body can't absorb B12 properly due to an autoimmune condition. While rare compared to dietary deficiency, pernicious anemia is a leading cause of B12 deficiency in older adults and can lead to severe, permanent neurological damage if untreated. B12 deficiency isn't just physical, it can actually mimic psychiatric disorders. We're talking about things like depression, irritability, psychosis, memory loss, and even dementia-like symptoms. A study published in Psychiatry and Clinical Neurosciences found that low B12 levels were significantly associated with depression, especially in older adults. And, another study in the Journal of Neurology linked prolonged B12 deficiency to cognitive decline, dementia, and even changes in personality. If B12 deficiency goes untreated, it can cause permanent nerve damage. This includes loss of coordination, chronic neuropathy, and honestly, irreversible memory issues. That's why early detection is so important. Here's where it gets eye-opening. Vegans and vegetarians, there's no B12 in plant-based foods. Adults over 60, at least 6% are deficient, and up to 35% have low levels. People on long-term antacids or metformin are also at risk. Patients with gastrointestinal conditions like Crohn's or celiac disease, gastric bypass patients, and those with autoimmune conditions like Hashimoto's or type 1 diabetes need to pay attention too. These aren't rare cases, they're millions of people. Good news: B12 deficiency is treatable. For most people, B12 supplements or dietary changes are enough. For absorption issues or pernicious anemia, B12 injections are necessary, sometimes lifelong. Your doctor can test your B12 levels, and if they're low, treatment usually starts right away. B12 might not get as much attention as vitamin D or iron, but it's just as critical, especially for your brain. With as many as 1 in 4 older adults possibly having low B12, awareness is key. So if you're feeling off, physically or mentally, talk to your doctor. A simple blood test can make all the difference. Like, subscribe, and share this video if you learned something new. Let's spread awareness, because B12 deficiency is more common than you think.